again, my name is Cassie Franklin, Community Engagement Specialist with the United Mitochondrial Disease Foundation, and your host for this month's episode of the Powerhouse Podcast. We're just coming off the heels of a huge World Mitochondrial Disease Awareness Week this month, where we saw unprecedented digital engagement numbers and a really successful virtual Capitol Hill Day for our advocacy efforts on Tuesday, September the 17th. I know that I have been involved in in-person Hill visits, virtual visits over my years with UMDF, and it was just so energizing to see such positive movement of bills through Congress last week on some of the very asks that we discussed on our Hill Day. So today, I'm really delighted to introduce you to our special guest, a powerhouse of advocacy. I want to bring on Miranda Franco, Senior Policy Advisor for Holland Knight, our governmental relations team in Washington, D.C. Hi, Miranda. How are you today?
I'm good. How are you?
Thank you so much. I'm doing great. Thanks so much for joining us in the Powerhouse. Miranda helps to provide policy counsel, strategy, coordination of our advocacy work on Capitol Hill. Thank you for joining us on the Powerhouse.
Thank you so much for having me.
So, Miranda, we're coming off of our Capitol Hill Day, our annual event, virtual Capitol Hill Day this year, close to 60 calls with congressional offices and their staff. Tell us all about it. I know you were fully booked on September the 17th.
Yes, it was a great day. And this is something that we've been doing annually now with UMDF members who are so kind to take the day and spend it meeting with their lawmakers and or their health staff who are devoted to the healthcare portfolio for their members of Congress. And it's just so impactful. Myself and my colleagues who reside here in DC spent a lot of time in the halls of Congress advocating for UMDF issues, but it's so critical for these offices to hear directly from their constituents, directly from those who are impacted by mitochondrial disease or dysfunction, so they can tell their personal stories that I think truly carry so much gravity with these offices. And over the years, we've helped educate members of Congress and their staff about what mitochondrial disease is and dysfunction and the importance of building research around it and research dollars and other elements. But if it weren't for the UMDF members engaging in things like the fly-in, I think all of that would not be as far along, as advanced as it is. It's been quite something over the last 10 years to go into an office and really have to start from the ground level explaining this to now going into offices and people are acutely aware because of the work of UMDF members through this fly-in and through other forums.
Yeah, it was amazing to sit in on a call myself last week with one of our amazing powerhouse advocates, Howard Corson, and he is just an absolute pro. So many of our advocates, they've been doing this year over year. They know the lawmakers. They have personal connections already. And so it's just very easy for them to make their asks, make their case, tell their story, make those personal connections, and just hold really effective calls.
Yeah, and Howard is the perfect example. I can't think of, anyone who is a better advocate and champion. And he's so well versed in the issues, particularly medical nutrition, because it's something that he's had to contend with as a parent of a child with mitochondrial disease. And even though in his state, he doesn't have to contend with some of the insurance loopholes, he's still advocating for the betterment of other states where they don't have this and to ensure that there's federal legislation to provide coverage for medical nutrition. So it just really speaks to how committed he is. And so it's been a real joy to work with him.
Absolutely. Let's talk about some of the asks that were made on our Capitol Hill virtual day last week. Telehealth expansion. So UMDF did a telehealth survey. We got 35 families to participate, and across the board, when it came to cost, comfort, quality of care, our families rated telehealth as just really high and important. Those visits even higher than sometimes than in-person visits. So talk to us a little bit about what's going on with the telehealth expansion and why that's so important.
Sure. So telehealth has been something that we've been advocating for over many years, as I think many of the listeners may know, after the COVID pandemic, and not to say that we are out of the pandemic, but as a byproduct of the pandemic, The Centers for Medicare and Medicaid Services, along with Congress, expanded waiver authority to allow telehealth to be permitted with the patient in their home, which wasn't the case prior to the pandemic. So that is a new flexibility that has been afforded since 2020 and has really been critical for mitochondria patients, and certainly any patient with sort of complex needs that might have to travel far distances to see their specialist, or might need to see a cohort of specialists that are in different locations. So it's really streamlined their access to care and has been so instrumental to just helping with their day-to-day management. And so one of the things that we've advocated for as UMDF year over year is an extension of those flexibilities, and we continue to do so this year because of UMDF member advocacy. Congress engaged and extended those authorities until the end of this year, which means that we continue to push for Congress to push those beyond the end of 2024. So we're quite optimistic that Congress will do so as part of a year-end health package, but that's part of what the UMDF membership brought to the Hill last week and shared personal stories and vignettes. UMDF has also done a survey to just show how meaningful and impactful that access to telehealth has been for them. Our ultimate hope is that Congress does something permanently around expanding telehealth, so we don't have to advocate for this year to year, but it will be a permanent fixture of our healthcare ecosystem. I would just give the caveat that that is complex from a congressional standpoint, that there is a cost associated with that. So the reason that Congress hasn't sort of advanced to that level yet is trying to figure out some of the costs, any concerns with fraud and abuse, and where the most integral service lines are for telehealth. So this is something that does have bipartisan support, but I think they want to give the right level of thought and commitment to how to expand it permanently. So in the interim, we continue to advocate for those expansions year by year. And again, we're quite optimistic we'll see something in this year's health package.
Right. Deadline December 31st, right? Like hopefully.
Yeah.
Hopefully we won't be down to the wire.
No, and we've seen all of the committees of jurisdiction move various telehealth bills. So I think I find it very surprising if something of at least a 1 year extension is not included in a year-end package.
Fantastic. We had a big win. The Accelerating Kids Access to Care Act passed the House. Talk to us a little bit about why this bill is important for our families, and what we can do to help get this through the Senate.
Sure. So very similar to telehealth, what the Accelerating Kids Access to Care Act does, which is led by Representative Trahan and Dr. Miller Meeks in the House, is that children on Medicaid with rare and medically complex conditions often need to travel out of state to receive care from specialists that are not available in their home. And so what this does, because some states require out-of-state providers to be rescreened to join their Medicaid program, even if they're already enrolled in their home state's program. So this creates a new pathway. It sort of eases that administrative burden for Medicaid providers to enroll in multiple Medicaid state programs if certain conditions are met. So this only pertains to provider screening and enrollment, sort of leaving care authorization and payment rates aside. But again, this really simplifies that process for Medicaid providers, thus hopefully opening access for more complex Medicaid pediatric patients. So we saw this move through the House rather seamlessly last week, which was wonderful news. The Senate has a companion bill, Senate Bill 2372, that is led by Senators Grassley and Michael Bennet. And so getting more and more co-sponsors on that bill. So the Senate moves the bill, and we see, again, this in the final package for a year-end healthcare bill. And so what we did last week was advocate for our House members to pass the bill when it was on the floor, and the Senate, we asked our senators to join the effort. So for those of you who are still doing follow-up, if you were with us last week virtually, or those of you who are engaging your senators while they're back home in the districts campaigning, this is certainly something to ask them to join the effort. And the more co-sponsors we have, the more people signaling their support for the bill, the greater chance it has for success in terms of ultimate passage.
And that's what we're looking for, and we're excited about. We're going to take a quick commercial break right now, and we'll be right back with you on the Powerhouse. Thank you for listening to the Powerhouse Podcast. Join us as we take every step toward treatments for mitochondrial diseases. Together, let's energize the fight. Register online at energyforlifewalk.org. Now, back to the Powerhouse. Thank you so much for joining us on the Powerhouse Podcast. Next up, Miranda, would really love to talk about the Medical Nutrition Equity Act. You'd mentioned that this is such a passion, and I don't want to say project because it's bigger than a project for him, for Howard Corson. It's so important. And I think he talked about this on the call, how, he's lucky. Their family is lucky because of where they live, that many of the supplements that Mara is taking that she needs are covered by insurance. But he is so passionate about the MNEA, and he is fighting for people across the country who he knows do not have access to many of the supplements that they need. So tell us all about why this is so important for our families across the country who might not be as lucky as Howard.
Yeah, that's a great question. So the Medical Nutrition Equity Act is something that's been led by James McGovern in Massachusetts, who some of you may know is also the co-chair of the Mitochondrial Disease Caucus, as well as Rep. Rutherford from Florida. They have really spearheaded the larger food as medicine movement, and this falls under that umbrella. And as many listeners know, at this moment, there is no cure for mitochondrial disease, but what has been found to help is response-specific vitamins and supplemental therapies, sort of known as the Mito cocktail. And so what's so critical is that it's not inexpensive for mitochondrial patients. As I best understand, and to your point, Howard can articulate this better than I can, the out-of-pocket costs can range wildly from $300 to well over $1,000, which just is not palatable, especially for something that's so critical to the sort of treatment for a mitochondrial disease patient. And so what MENA would do is help sort of alleviate these financial expenses and ensure and mandate insurance coverage by federal health programs and private insurance for these medical nutrition elements. And this is something that has broad support. UMDF certainly endorses this effort. NORD and other patient groups are highly active in this space as well. So we've been advocating this for a couple of years now. It is not likely to move this year, but again, this is, as you'll hear me say, and I said earlier, that a lot of this is an effort of garnering as much support as possible, getting as many co-sponsors as possible. The more co-sponsors we garner and we show that support, the greater likelihood that a bill has of going through the legislative process. And so a lot of that is just education, which is why it's so critical, and thankful to Howard and others who participated last week to tell their personal stories. So I do think that's what really compels these offices once they understand. I think the one thing I would just say that I don't know if people, unless you're sort of doing this day in and day out, appreciate is that, there are in one session upwards of, 4,000 to 5,000 bills that Congress is looking at across the whole gamut of policy issues, not just healthcare, certainly. And so if some of these things aren't drawn to the attention of staff and or their bosses, it's easy to sort of fall underneath the radar, which is why it's so important that we're flagging them and bringing them to the forefront and attention of these staff so they can prioritize them. And by hearing a personal story about how a constituent has struggled to obtain these medical supplements that are so desperately needed, that will really sort of move the needle. And we've seen it. We've seen more co-sponsors join following our meetings that we had last week. And so that sort of forward momentum, while it might not happen overnight, unfortunately, is sort of the long, arduous process of legislation. But the more we can educate, the better off I think we'll be.
Yeah, I mean, this is life-changing, life-saving supplements and nutrition for our mitochondrial disease patients and families. I mean, how can you not prioritize that, right? So our families and our caregivers, our advocates, where you can go to take action, you can go to our website and take action on the Medical Nutrition Equity Act. Let's see if we can get more co-sponsors on this bill, and that's at umdf.org/advocacy. So we want you to get involved, share your voice, share your stories, and take direct action right now on the Medical Nutrition and Equity Act. Now,
I'm so sorry. And the one thing I just quickly note to those who joined us last week would be aware. So there's a House bill right now. A Senate companion bill is forthcoming. So if you're looking to go onto that grassroots website and reach out to your senator, that won't be readily available. But in the near term, we anticipate Senator Cassie from Pennsylvania reintroducing this on the Senate side his sort of co-sponsor or original sponsor is sort of being worked out right now, but it's sort of imminent introduction in the next week or two on the Senate side.
That's exciting movement. Thank you. Well, speaking of exciting movement, the FDA's Rare Pediatric Disease Priority Review Voucher Program is a mouthful. Miranda, talk to us about what this is, why it's important, and like exciting news this just happened this month.
So again, sort of like accelerating kids, we were there, and then less than a week later, all this movement happened. So for those who might be new to this mouthful of a program, the FDA's Rare Pediatric Disease Priority Review Voucher Program is something that started in 2011. And the impetus is to support faster access to cures for children with rare diseases as part of the FDA's Priority Review Program. Essentially, it incentivizes manufacturers to develop treatments for rare pediatric conditions. And the goal is to get manufacturers to invest and do research and development in a space that they might otherwise not, because it's such a small cohort of patients that are impacted. So since 2011, more than 50 pediatric review vouchers have been awarded against 39 rare diseases. So of 90% of those rare diseases have gone to treatments for diseases where there's no approved therapies. So really significant. This program, if Congress does not intervene, would expire on September 30th, so in 6 days from today. And so this is, again, another area that we strongly advocated for is reauthorization of this program. That was a big ask of ours last week during our virtual fly-in. And so I am pleased to report sort of a couple of different notes here. As some of you who might be following the government funding, there's what's known as a continuing resolution that will fund the government for sort of a short window of time until they can come up with a long-term solution. They'll be voting on that presumably this week, but that short-term CR includes an extension of this program until December 20th. And that sort of sets the stage for them to, again, have inclusion of this in a year-end package and reauthorize the program for the full 5 years. So to that end, last week, the House Energy and Commerce Committee unanimously passed something known as the Creating Hope Reauthorization Act as part of the larger Give Kids a Chance Act, which would reauthorize this program. And then the Senate Help Committee on the Senate side is holding a markup on Thursday around this issue. So a lot of forward momentum around this program, and we are very optimistic that it will be reauthorized.
Oh, that's fantastic. So we need to please take action, urge your senators to support this critical legislation.
Those on the Help Committee on the 26th, and then the hope is that we see this beyond the short-term sort of solution as part of the continuing resolution fully get reauthorized for 5 years.
That would be exciting.
Yes.
5 more years. Okay. So since 2012, our Congressional Mitochondrial Disease Caucus has been meeting. That's the earliest I could find of it. The very first meeting of the Mitochondrial Disease Caucus. Talk to us a little bit about this, Miranda, and how it's changed over the years, and who can we be working on for recruitment to the Mitochondrial Disease Caucus?
Sure. Great question. So I think 2012 is right. And UMDF can take full credit of helping to constitute this caucus. Caucuses are traditionally on the House side. There are a few in the Senate, but that's rather rare. And so a caucus is an entity of members of Congress who join a caucus in an effort to provide educational briefings for the year, to educate members of Congress on a specific issue. The topics range wildly between cancer caucuses, there's even a wine caucus, and certainly our mitochondrial disease caucus, which is led by, as I mentioned earlier, Congressman McGovern, and then Congressman Fitzpatrick from Pennsylvania. And they, again, work with us to hold briefings throughout the year on a whole host of topics. We've actually done one on the importance of telehealth in the past and how critical of a lifeline that is for UMDF members. We've looked at different disease areas that are also impacted by mitochondrial disease, like neurological disorders, Alzheimer's, Parkinson's, and the research that's being done in that space. We've held an array of briefings over the last decade plus, but we've also really critically used the caucus to spearhead some of our efforts with the Department of Defense. Because of the caucus and working with the entirety of the caucus led by those chairs, we've been able to include mitochondrial disease under the Department of Defense's congressionally peer-reviewed medical research fund, which means that researchers who are focused on mitochondrial disease can try to pull some of those dollars down to really focus their research. That's been really significant for us. And every year we have to work to be retained in that program. And the caucus certainly helps us do that. And then they've also been instrumental in helping us drive report language through the National Institutes of Health. Through them, we've done different workshops on mitochondrial disease, but we've also gotten them to focus on the impacts of long COVID and mitochondrial disease, the correlation there within, but also trying to focus the sort of silos at the NIH to make sure there's coordination across all the agencies as they look at and examine mitochondrial disease and try to further and advance that research. So we're always looking to bolster the caucus. We have about 25, 30 members at the moment. We're always dealing with retirements, so people kind of fall on and off. And so a big part of our ask is always every year to join the caucus if we're meeting with an office that isn't already on the caucus. For those that are, we're greatly appreciative of their support. But if they're not, we ask that they join. And so I believe we have a decent list of who is on. The list is managed by congressional staff. And so if you are meeting with an office that's not on, we encourage you to ask them to join and just talk about how critical the caucus has been in terms of educating Congress about some of the areas that we're impacted by and some of the legislative priorities that we think should be advanced.
Huge. I mean, and like you said, not just about educating them about mitochondrial disease and mitochondrial disease community issues, but also unlocking those federal research dollars for our researchers on mitochondrial disease and mitochondrial dysfunction is huge for our community in the future of treatments and cures. And I believe on our website, again, you can take action to have your representatives join the Mitochondrial Disease Caucus. And that's at umdf.org/advocacy. I want to thank Miranda. Thank you so much again for coming. I know it's so much powerful information in just a short amount of podcast time, but it's really been a joy. And thank you so much for all that you've been doing this month and the last decade plus for UMDF and the mitochondrial disease community.
Well, thank you. And thank you so much to everyone that's listening. And if I could just impart one last thing is that I know it's easy to get disenchanted with, as I sit here in Washington, D.C. Congress, but I can't tell you how much advocacy really does make a difference. And so the more you engage, I think the more movement that we will see. So I just appreciate everyone's efforts to date and look forward to working with everyone moving forward.
Thank you for watching the Powerhouse Podcast. Are you looking for answers and do you think it might be mito? We are here to help. The United Mitochondrial Disease Foundation provides access to genetic testing to those suspected of having mitochondrial disease through our UMDF no-cost genetic testing program, which is hosted in partnership with Probably Genetic. Talk to your doctor about this opportunity and find more info at www.umdf.org/genetic testing. Now, let's get you back to the Powerhouse. And that's our Powerhouse Podcast for September 2024. It's been a really powerful 25 minutes, and we will see you next month on the Powerhouse.